Hello everyone, welcome back to GrowMed. This channel is a one-stop guide for the Fmge aspirants. So if you're new to GrowMed, then subscribe and tap the bell icon to get all the notifications. As I was receiving many messages, DMs and comments to make the must-do topic of the pharmacology, list of the must-do topics. So here it is. So we will discuss the must-do topics. I have already uploaded the videos of the list of the must-do topic from the other subjects, so you can watch even those videos. It will help you to get an idea of which topics you must concentrate more. So let's start the video. The topics which I will be discussing now, these are mainly based on the previous year questions and the repeat topics. So anti-malaria drugs. So this malaria, it is a very important topic because every year the questions are asked on malaria, because malaria, it is the most common disease in India and comes in many subjects like the PSM, then comes in the micro, patho, then medicine. So it is a must do topic, and from pharmacology you need to read about the drugs. So questions are asked which kind of anti-malarial drug is used for which organism, because there are various types of the malaria, right? Like the plasmodium vivax, then the plasmodium falciparum. So questions are asked in for which organism which kind of drug is used. And also there's a proper treatment protocol for the malaria, like for the prophylaxis, for the prevention if someone is traveling to the endemic states. So which kind of prophylactic drugs you will be using, so you need to look at all those points. Then moving on, pregnancy. So questions are asked on the drugs which are safe in pregnancy and drugs which are contraindicated in pregnancy. So I will try to provide a list of these things, the safe drugs and the contraindications, and along with that I will try to cover the side effects, because which drug, by using which drug, what kind of side effect will be seen. Okay, so the list of the safe drugs and the contraindication, it is an important topic. So questions can be asked like a clinical case. The clinical case can be asked that a pregnant female, she has some bleeding disease and she was given warfarin. Okay, so you need to switch the warfarin. Why? So it will be like it is teratogenic and it will harm the fetus. So question can also be asked that a female was there and she was taking warfarin, so which kind of uh, side effects can be seen, something like that. Okay, so this was about some example. Then moving on to glaucoma drugs. So classification is asked on the anti-glaucoma drugs, like drugs which are used in the acute glaucoma and drugs which are used in the chronic glaucoma, their mechanism of action and also side effects. Like there's a famous question asked that a patient is having glaucoma, then after taking some drug he developed asthma, what will be the drug? So it is the timolol. Okay, so question can also be asked that the drug of choice for the glaucoma, and it is the latanoprost, which is the prostaglandin F2 alpha agonist. Okay, and this glaucoma can also be asked in integration with the ophthalmology, so it is also an important topic and a repeat topic. Then moving on, anti-TB drugs. So drugs used in the tuberculosis. So we will be using the RHZE combination, right? Rifampicin, isoniazid. So you need to look at the mechanism of action of all these drugs and also the side effects. And there's a question repeatedly asked on this drug, bedaquiline. So do look at its mechanism of action and the side effects. Then moving on, this is also a repeat topic and frequently questions are asked on this tamoxifen. So it is a selective estrogen receptor modulator, and questions are asked on its uses and contraindications, because it is used in the breast cancer and there's a very serious side effect of it, that is it will be increasing the risk of the endometrial cancer. So clinical case can also be asked in integration with the gynecology, that a female, she was having breast cancer and she was taking this tamoxifen, and after few days she presented with bleeding, vaginal bleeding. So which kind of drug was used or something like that. Okay, so this tamoxifen is a repeat topic. Then moving on, antipsychotic drugs. So this topic is also important as questions are asked on this in integration with the psychiatry also, and usually this extrapyramidal side effects, one question is a compulsory question. One question will be compulsory coming usually on this extrapyramidal side effects, and if these side effects are seen, what will you, how will you treat them, how will you manage this patient? Like for example, the extrapyramidal side effects, there are the acute dystonia, then dyskinesia. So do look at this side effects, and also questions are asked on the classification, that is these are typical and atypical ones. So typical means they will be acting only on the D2 blocker, and atypical means both D2 and serotonin. Okay, then moving on, diuretics. Diuretics is also an important topic, and diuretics also you cannot miss. So questions are asked on its types and the mechanism of action. So there are loop diuretics, then thiazide diuretics, and then acetazolamide. So questions are asked that loop diuretics acts on which part of the nephron, thiazide act on which part of the nephron, or question can also be asked based on their side effects, because these they increase the metabolic products and also retains certain ions. Okay, so they will increase the ions in the blood, so these will be causing certain side effects also. Then moving on, questions are asked on the cycloplegic drugs, that is the atropine, then the homoatropines, cyclopentanol. Okay, so questions are asked mainly like a case giving that a child requires cycloplegic action, which of the following drug you will use. Okay, something like this. Then moving on, anti-cancer drugs and side effect, you cannot miss this topic. So every year there's a question on this anti-cancer drugs. Every year there's a question on this anti-cancer drugs, mainly on the side effects. The question is mainly pointing towards the side effects, so do look at the side effects of all the cancer drugs. So in the July 2023, there was a question on this cisplatin. So cisplatin causes which of the following symptoms, and it was the GI symptoms. And the anti-cancer drugs, so they usually cause the nausea and vomiting, right? So questions are also asked that which drug will be used to treat the nausea and the vomiting induced by the anti-cancer drugs. Then moving on to the gout. So gout drugs used in the gout, that is mainly the allopurinol, probenecid. So these are the main drugs. The drug of choice, the allopurinol, and questions are asked on its mechanism of action. So a case can be given describing that elderly male, he is having swelling in the toe and increased uric acid levels. So how will you treat it? So you need to first make the diagnosis that it is the gout and then treat it accordingly using the allopurinol. If a question is asked like this, that a patient is suffering from gout and he was given allopurinol, so what is the mechanism of action of this drug, or how does this drug help the patient? So the pattern of the question can be different, the language of the question can be different. Okay, then moving on, lithium side effect. So questions are asked on the side effects of the lithium, as this drug is used for mania, as it is a mood stabilizer. Okay, and side effect, it usually causes tremors, and then it also causes imbalance of the thyroid, so either increases the thyroid hormone or decreases the thyroid hormone, so hyper and hypothyroidism. So there are various other side effects caused by the lithium, so you need to look at all the side effects. Then moving on, the questions are asked on the graph, mainly the potency and the clinical efficacy, that giving a graph that which drug is more potent, which drug is more efficacious. Okay, so the right one, the left one, it will be more potent, and the right one will be the less potent and the efficacy. Okay, so do look at these things also. Then moving on to the emergency contraception. So questions are asked mainly clinical case, that a female, she wants emergency contraception, she had intercourse in so and so hours, so which is the best? Usually this is asked mainly on the IUCD, because it lasts, its action lasts longer, that for 5 days. And but over the counter, the most easily available and most easy to use is the progesterone only pills. So there are various other drugs also used for the contraception, like the. Then moving on to the next topic, anti-emetic drugs. So questions are also asked on this anti-emetic drug, and mainly questions are asked on the chemotherapy induced vomiting and nausea. So what drug you will be using? And it is most commonly the cetron drugs which are used, the ondansetron, then granisetron. Okay. Then moving on to the MTP drugs, drugs used in the medical termination of the pregnancy. So we will be most commonly using mifepristone and the misoprostol. So do look at the doses also. Then moving on, smoking de-addiction. Sorry, there's a mistake, guys. So the smoking de-addiction drugs. So questions are asked on this drug, and there's a famous question asked, and this question is repeated many times, that vernicillin, it is the drug used for the smoking de-addiction, and questions are also asked on its mechanism of action. Then the thyroid drugs, questions are asked on the classification, the types of the thyroid drugs and their mechanism of action, and along with that the side effects. A very popular question from the thyroid is that the thyroid drugs, the methimazole and the carbimazole, they are contraindicated in the pregnancy because they are teratogenic. And the safer thyroid drug to use in pregnancy is the propylthiouracil. So this question is repeated multiple times, that which of the following antithyroid drugs is safer to use in pregnancy. Okay. Then moving on, the classification SNRI, SSRI. Questions are asked on the names of the drug, that which is the SNRI and which is the SSRI. So you need to just by heart those names. Then drug poisoning and their antidotes. So quite clinical cases are asked, that a drug was given, like a patient took some substance and he is coming to the clinic with so and so symptoms. So what is the drug and what is their antidote? Okay. And sometimes they can also give the drug and ask their antidote, like for example organophosphate poisoning, it is the antidote. For the benzodiazepines, it is the fumazenil. Then there can be iron overdose. Then iron overdose, the antidote is the desferoxamine. Okay, so these were some examples and the previous year questions. Then moving on, cholinergic and the adrenergic drugs. So these are the basic things in the pharmacology. So we usually start the pharmacology by reading this cholinergic and the adrenergic drugs. And these drugs, they are having a wide variety of uses. And adrenergic drugs mostly used in the CVS. The beta blockers, they are used for asthma, everything. So you need to read all the things related to this cholinergic and the adrenergic drugs. And along with that, you need to also focus on the effects of the parasympathetic and the sympathetic system. So what actions are carried out by parasympathetic and what actions are done by the sympathetic, and along with that the neurotransmitters. The parasympathetic, the acetylcholine, it is the main neurotransmitter, and for the sympathetic it is the adrenaline and the noradrenaline. So you need to also study about the receptors, that ACH acts mainly on the muscarinic and the nicotinic receptors, and the adrenaline alpha and the beta. Then moving on to the anesthetics. Anesthetic is also important because if you cover all the anesthetic drugs in pharmacology, then it will be easier for you in the anesthesia. So you need to read about the local anesthetic, general, and the skeletal muscle relaxants, their mechanism of action, and also their classification. Like for example, the muscle relaxant, they are classified into the depolarizing and the non-depolarizing. Then the local anesthetic, these are also classified into the esters and the amides. So you need to look at which is ester and which is amide. Okay. Then moving on to asthmatic drugs. So questions are asked on the asthmatic drugs, giving a case and based on the features described in the case, that what is the severity of the disease, how long that disease is, and how many times the person is getting this asthma attacks. So based on that, you will be providing the treatment. So look at the features described in the case. Then moving on, antiplatelet drugs. So questions are asked on this. On the classification or clinical case, questions can be asked that a person had suffered from MI, and for prevention in the future, what will you give? And also questions are asked that the aspirin, mechanism of action of the aspirin. And then the questions are also asked on the mechanism of action, that which drug acts by what method. So do look at all those points. And also the questions are asked on the clinical trials. So there's a one question every year asked on this clinical trial. There are 4 phases, 1, 2, 3, and 4. So you need to read that what is done in which phase, and the drug is given to whom. Like in phase 1, it is the healthy human volunteers, and phase 2 onwards it will be given to the patient. Into a small amount of patient, like approximately 200, then 2000, and then approximately 20,000 to lakhs of people will be getting it. And in 4 there will be post-marketing surveillance done. So these were some important topics which you must cover from the pharmacology. And also this pharmacology mainly about the drugs and their treatment of the diseases. So this comes in integration with the surgery and the medicine. So while reading the surgery and the medicine, integrate it with the pharmacology and try to read it. Like that you will be able to complete the pharmacology as well as the diseases from the surgery and the medicine. That is the treatment part. It will be easier for you. Like let me give some examples, like the Raynaud phenomenon. Repeatedly questions is asked on this treatment of the Raynaud phenomenon, and it is the calcium channel blocker. So this comes in integration with the surgery and the medicine. So if you read these things in the surgery and medicine, then it will also help you to solve these things. Then there's another question, the famous question about the mucormycosis. What will be the treatment for the mucormycosis, which is the amphotericin B. So you will learn about this in the pharmacology as well as the microbiology. Then you need to also look about the anti-hypertensive drugs, which drugs are used to treat the hypertension and what is their mechanism of action. Then look at the anti-arrhythmic drugs, the classification, class 1, 2, 3, and 4, and 5. So which drug falls in which class, you need to by heart all those things. So there's a lot which you must cover in the pharmacology. I have already posted a video on the pharmacology one-liners which you must know, and those also are the mostly previous year questions. So do watch that video also to clear your concepts and to get an idea of the questions asked. I have tried to cover almost all the important topics and the repeat topics in this video. Hope this video will be useful to you all and will help you all in your preparation. Thank you so much for watching this video. Like the video, share this video with your friends, and subscribe to GrowMed. Thank you so much. Bye bye.